Nestled among the rich soils and vast agricultural landscapes of Western Victoria, Australia, West Wimmera Health Service is the major healthcare provider across a catchment area of some 22,000 square kilometres. That's almost a third of the size of Ireland and larger than over 100 countries of the world. The area we service encompasses 9 rural townships and traverses internationally renowned national parks, including the Little Desert, the Grampians, known as Garrawood to our local Indigenous peoples, and Mount Arapiles, which is known for its world-class rock climbing. The geographical spread of our operations brings extra challenges, yet we manage to uphold our commitment to delivering quality services that our patients, clients, and communities can rely upon come rain, hail, shine, and coronavirus.
The 4 seasons, are just beautiful. You've got the most beautiful sunrises and sunsets. You've got deserts nearby. You've got wine regions, which, we like to do on the weekends. There's a great rec reserve to take the dogs out. They go swimming, they go hiking, and I guess there's so much nature around here that, it's only a short drive to somewhere different for them.
My name's Emma. I'm a physiotherapist. I'm a mum. I'm a business owner, I'm a volunteer, I'm a team leader, I'm a friend, I'm a member of this community, I'm a part of a family.
I am a husband first and foremost. I'm also a volunteer with a lot of our organisations in town. I volunteer with the Nil RSL sub-branch, being the secretary of our local club. I also am the local president of our Freemasons in Nil, and most importantly, I am a volunteer with St John Ambulance, which I've done for 21 years.
We had decided we were going to leave where we were living. We started looking along the Western Highway because it was sort of the link between the 2 major cities. So the CEO was out on the road outside the hospital waving a lunchboard.
Oh, Reese, how are you?
Oh, Richie, what are you doing?
Oh, I'll be on the highway trying to get some more workers.
That'd be good. Really sure what we have to offer.
Love your work, mate. Stick at it.
Thank you.
I always had an interest ever since a little kid on first aid and helping the community. St John's helped me a lot with both my professional and my community. I love the Wimmera in particular because everyone is so friendly, welcoming. They have been so welcoming to myself and my husband, and I love being able to give back to our communities as much as I possibly can.
We love living in this area because of the lifestyle. It's safe, it's easy, it's fun. There's plenty of opportunities for our family to thrive. And the best part, I think, about this community are the people. They're generous, they're fun. It's really nice. You're walking around town, you know who most of the people are. It's a real sense of community. I've got 2 kids. They love coming along to the local footy and netball and watching us play.
So I did my nursing training down at Ballarat, but I always enjoyed community and nursing. That was my real passion. And so I ended up in a town about an hour away from here where I did my 12-month grad year. Then I came over to West Wimmera and was able to, explore all the region that we had to offer. I did community nursing in other towns as well as working in our theatre and in the ward here as well. So I got a very varied nursing experience, which is what I love.
So I grew up here in Nil originally. I lived on a farm out of town. I luckily got into physio and I went over to Adelaide to study there. And as I was nearing the end of my physio course, I was working as an allied health assistant at a big hospital in Adelaide. And I really loved that. I loved the fast pace and the big team, but there were some other skills that I wanted to develop. And I knew that the environment here at West Wimmera Health Service was great. So I thought I'll come back, get a bit of a taste of all the different types of physio, because you can do that rurally, which is really unique about this environment. And 10 years later, I love my work.
So within the house service, I'm actually an endorsed enrolled nurse. What that means is I provide support to the registered nurses. We do have acute presentations where people come in maybe after an accident or some sort of emergency where they've got to be assessed. And we also have an acute ward, so I provide support to the registered nurse there with patients that might come in with various ailments that can be treated on site. And then we've got the 11-bed nursing home side where we get to develop a bit of a rapport with the residents and, do different activities, all those sort of things. The acute patients too are quite often people you already know from the community, so it's more of a family environment, I think.
So my role is the clinical manager of community nursing, and my role entails looking after our community in their homes. I look after all our community nurses, midwives, maternal child health, refugee health, diabetes education. So I've got quite a lot of staff that are under me. But we also have towns that we look after in our catchment as well that also I manage as well, which is fantastic.
What I love about being a physio here at West Wimmera Health Service is that diversity. I love getting to see a broad range of clients from birth through to the aged care side of things. We also have a great team and it's a great culture here, which I think makes work so much better and makes such a difference. And being from this community, I really feel like I'm giving back and being able to help people in a way that's really meaningful. We were redeveloping our allied health and community health building. When I was working in Adelaide as an allied health assistant, I was working in a hydrotherapy pool, so I saw firsthand how beneficial it could be, and I thought, wouldn't that be great if the people here in our small community could have access to that service? It was a huge job from start to finish that involved a lot of people working really hard, and then to be able to work in it each day and to be able to take my kids there for swimming lessons now, it's pretty special.
Serving all age groups, our range of healthcare offerings span health promotion, community and allied health, disability services, acute hospital, and residential aged care. Our care model is designed and delivered with the community and its people at the core, and it often sees team members travelling significant distances to provide care to people close to their homes and increasingly so within their homes. It's clear that we wouldn't be able to do all of this without the skill, resilience and dedication of our diverse healthcare team. With 584 employees and 55 volunteers, we're proud to be one of the largest employers in our region and a vital strand in its social fabric. It means we aren't just in our community, we are the community. More often than not, we genuinely know the people we're caring for. There's an unspoken but deep-rooted understanding of our community and lifestyle and how these intersect with responsive rural health and general well-being. It brings a whole new level and meaning to delivering safe, effective, person-centred care.
So what I love about working within the West Wimmera Health Service, every day is something different, getting that opportunity to do a combination of all the good things about nursing, but you still get to build those relationships with people. You get to learn about their lives and their families and their interests. And I think that's really good. And something I've never had the opportunity to do in all my years of nursing.
The thing that I love most about my role, I love the team that I work with. We work really well together, we work hard, and I think that we work really hard at work that's worth doing. We have a real sense of achievement at the end of the day. We know that we've made a difference. We really advocate for our patients and, try new things, and we are all passionate to keep learning and keep making sure that we provide a valuable service to our community and we do make a real difference in people's lives.
I just love being able to have our community members stay at home as long as possible with whatever services we can provide to keep them in their homes. I think it is so important, and by my job, I hope with my staff and partnering with the other departments, we can achieve that. And that's what really gets me excited every day coming to work, knowing that we can make a difference to our community members' lives.